Welcome back to your SIU Medicine Minute. Today I am joined by Dr. Elisabeth Robinson, an orthopedic surgeon for the Department of Surgery. Dr. Robinson, thank you so much for joining us today.
Thanks for having me.
We really appreciate it. So today I want to actually discuss the anterior cruciate ligament, more known as the ACL. And I'll just really kind of start off by what is the ACL and how does it get injured?
Well, the ACL is a ligament in the knee that connects the femur or the thigh bone to the tibia or the shin bone. It, along with the other ligaments in the knee, provides stability for the knee. It's often injured during athletic events with a non-contact pivoting injury, but can also be a direct blow. And the most common sports are basketball, soccer, football, and skiing.
What types of signs is there when it comes to tearing an ACL?
Well, the athlete sometimes hears a pop and then oftentimes has a swollen, sore knee afterwards. It feels stiff and as if the knee could give way or just be unstable for them. In the office, I can examine the knee and tell the ACL is torn because it slides and pivots on itself, mimicking that instability that the athlete feels.
Can a torn ACL actually heal on its own?
Well, that's actually a complicated question. The ACL doesn't really heal back to itself, but some people are able to adjust their lifestyle and their activities in a way to compensate for not having an ACL and still have a stable knee. Most younger folks and athletes are going to need an ACL in order to have stability, and without that would have cartilage damage, which leads to early arthritis.
How would an ACL tear be treated?
So most of the time we treat it with what's called ACL reconstruction, which is taking another tendon from the knee and replacing the ACL with that tendon. It's done with arthroscopic surgery, which are small poke holes in the skin and a camera, and the new tendon is linked from the femur to the tibia over the path of the old tendon.
Dr. Robinson, how long is it before an injured athlete can get back to their normal activities?
Well, unfortunately, the ACL is a season-ending injury. So right away, physical therapy starts, surgery, and then afterwards working on trying to get motion back and strength. Usually the athlete does some functional tests that mimic their sport, like cutting, pivoting, hopping, jumping, to allow them to clear and make sure that knee is ready to get back to play. And that's usually somewhere in the realm of 6 to 10 months, with about 9 months after the injury and surgery being most common.
Dr. Elisabeth Robinson, orthopedic surgeon for the Department of Surgery, thank you so much for joining us.
Thank you.
Thank you for watching today's SIU Medicine Minute.